Record-breaking heat continues to send people to the hospital battling heat-related illnesses or severe contact burns.
But as Team 12's Adriana Loya reports, it's also extending hospitalizations for homeless patients at one Valley hospital.
An emergency doctor here at Valleywise Health tells 12 News homeless patients who have recently recovered from a heat-related illness have gone from waiting hours to now days for a shelter bed after being discharged. But nonprofits tell me the answer to that is tricky.
When a person who lives on the streets gets sick, they end up in the hospital. Once better, they work with organizations to get discharged and transferred to a shelter for further care. But during the record-breaking heat,
it takes a big strain on people's health.
Dr. Fran Lovecchio from Valleywise Health says some patients have had to wait days for their next bed.
It's not uncommon to have 3 or 4 people waiting when we first start the morning that are waiting for a shelter bed or what we call placement, a place to go that's safe for them.
If somebody goes to an ER, then gets better,
we generally try not to discharge them to nowhere, back to the street during the middle of the day, because they're going to come right back, and it's just not the right thing to do.
But this July,
the problem was the worst we've seen in a while.
The state health department reports more than 3,000 emergency room visits due to the extreme heat so far this year.
So within the shelter, there is a number of beds set aside for patients discharging from a hospital setting.
Stephanie Martinez is with Circle the City, a nonprofit that helps the homeless population that partners with 7 hospitals across the valley. She says unsheltered folks might be waiting for beds for several reasons.
There are times where the patient may refuse to go to one of these hospital set-aside beds.
Both doctors and organizations expect hospitalizations to rise as the number of homeless, along with temperatures, continue to rise.
We see an increase year after year, and unfortunately, sometimes the resources just aren't keeping up with the increased need in the community.
Adriana Loya, 12 News.